Welcome back, everybody. I hope you had a nice break, filled up your coffee. I think that we are stepping into some of the best stuff we have had yet in this conference. It's now time for the penultimate session of this conference. The title is Charting a Course for Infant and Early Mental Health in Canada, Reshaping How We Think and Support Mental Health in Canada. Now, Canada is lagging other development countries in its policies, practices, and research in the area of infant and early mental health, compromising the well being of future generations. This panel will discuss how infant and early mental health promotion at the Hospital for Sick Children is forging a path in Canada for the inclusion of infant and early mental health policies, practices, and research focusing on mental health. Panelists will discuss the core components needed for an infant and early mental health friendly organization, community or even community and practitioner, and how IEMHP is developing and evaluating training, tools, and resources to lead and support this change in Canada's approach to mental health. I just want to say a thank you to the Canadian Fetal Alcohol Spectrum Disorder Research Network, CanFast, for sponsoring this session. And I am really honored to introduce to you the moderator. Dr. Chaya Kulkarni is the Director of Infant Mental Health Promotion. That is the IHP, Hospital for Sick Children. And Chaya, I'm listening to everybody prepare for this session behind the scenes, and I just cannot wait. So take it away.
Thank you very much, Jody, for that introduction. And I want to first introduce my panelists who are joining me for this conversation today. So we have first Dr. Purnima Sundar, who is the Executive Director at the Ontario Centre of Excellence for Child and Youth Mental Health. Purnima's worked in the area of mental health with 25 years of experience doing community-based work, participatory action research, evaluation, implementation, and knowledge mobilization in the areas of child and youth mental health and race and equity. She, as the executive director, she does set the strategy and the vision for the center. And I just have to acknowledge the leadership that the center has actually shown through Purnima for the work around infant and early mental health in Ontario, and really supporting us and amplifying the work that we've been doing. We also are really excited to have Dr. Rob Santos with us. Rob is currently, by training, a clinical psychologist and has returned to clinical practice and continues his longstanding cross appointments as assistant professor in the Department of Community Health Sciences and research scientist at the Manitoba Centre for Health Policy, Max Rady College of Medicine, Rady Faculty of Health Sciences, University of Manitoba. And in 2021, Rob also started as the new chair of the research department at the School of Health and Community Services at Red River College. Prior to this, and when I first met Rob, he was actually the assistant deputy minister of the Healthy Child Manitoba office. And he provided leadership to that portfolio under two different governments, both progressive, conservative, and new democratic governments. And I think really charted a course, at that time that many of us in other provinces looked at. So I'm really excited, first of all, to just have Rob and Purnima here. I've known both of them for a long time, and they have watched me go through this journey that I'm about to share with our audience today. So having said that, let's get started. So IEMHP, for those who don't know, stands for Infant and Early Mental Health Promotion. And this little group was started at the Hospital for Sick Children in 1989, so a very long time ago. And at the time was really just not even barely a full-time person. It was two sort of part-time people, very focused on Toronto and Toronto practitioners. And today we're a national organization really looking for better access, for better outcomes, and building competency, confidence, and capacity for a stronger country through infant and early mental health. For those who may not be familiar with us, you can visit our website and you can learn more about our vision, our mission, and our values. But essentially, our vision to improve outcomes across the lifespan for children And we do this by translating and promoting the science of early mental health and practice with families during pregnancy, infancy, and early childhood. And the ultimate mission is for healthy minds from the beginning. And I think this is not a hard thing for most people to buy into, to agree. This is really important. So just a little bit about the funding that we have from KBHN, which has really allowed IMP to move, move miles in terms of trying to position ourselves within the country. So the current funding that we have is actually helping us to create a structure and function that supports our work, allows us to increase access and awareness to infant and early mental health information across the country, build skills specific to infant and early mental health, create opportunities for training at all sorts of different levels, and to create tools and resources that can support communities in their efforts to support and build capacity around infant and early mental health. Prior to this cycle of funding, IMP was actually funded by KBHN for a project called Nurturing the Seed. This was a project that we began several years ago in partnership with several Indigenous communities in Canada. And I wanted to mention this because, in fact, our work with Nurturing the Seed actually led us to this work that we're doing with our KBHN funding. Our Indigenous partners have taught us so much about how we need to approach this work, and it has informed the work that is currently underway with the KBHN funding. So the first steps as we looked at, how do we get better reach, better access, et cetera, was we needed to create a new structure for IMP. We had a number of committees that had really existed pretty much since 1989. And it was really time to move to a different kind of structure. So we created a leadership table with different experts from across the country. Working groups came out of that. We also did an environmental scan. We are in the midst of redesigning our website to reflect more of a hub, a go-to location, redesigning our in-person training as well. Also creating evaluation strategies for infant and early mental health activities, and of course surveying our partners, asking our partners what would be helpful for them as well. Okay. So our leadership table, which consists of a number of people, both Rob and Pranima sit at that table. But through our work with that table, we actually identified the need for 4 working groups. And I have to stress to you, these are working groups. When these people agreed to come on both the leadership table and the working groups, but especially the working groups, we made it really clear. Like, it was roll up your sleeves. We don't need you to tell us how good we're doing, how well we're doing. We really need you to be more critical and really help us to understand what we need to do better, where the gaps are, what we need to fill. And in that way, what we really started to realize was that we were the intervention. I mean, the problem, the diagnosis was that Canada lacked any sort of cohesive policy or strategy around infant and early mental health. The solution to that, or the intervention to that, is IMP, Infant and Early Mental Health Promotion. Our goal is to raise awareness and to correct that. So we are, as it stands, when we did the environmental scan, what we learned was we are the leading organization in Canada dedicated to infant and early mental health. Other organizations and resources that are in this space are largely in the United States, with some in the UK and in Australia. Training opportunities specific to this area are actually quite limited. We don't have a path in Canada for individuals who want to pursue any kind of further study in this area. So there's clearly an opportunity for IMP to provide some leadership. We've started by redesigning the website and building capacity. We have established a learning center, resource and innovation center, and a resource and tools center on the website, trying to make it easier for practitioners to navigate depending on what they're looking for. The website is the entryway. It's not the only way people can communicate with us. We definitely are still available by phone. And when we're out of this pandemic and it's safe to travel, we will, and we have already in Ontario started traveling again. We will start delivering training in person. But I think what's exciting is that people are comfortable making the first meeting with us through our website. And so, this is per week, we're seeing 1,100 visitors on our website, which is pretty exciting. We've also invested in a learning platform with Thinking Cap. So this is where our learners will now be directed to for any and all learning, whether it's learning that is free, and there's lots of free stuff that individuals can access, but also we do a lot of learning for agencies or for provinces. And now our learning platform will be able to support that, and I think provide a more seamless experience for people. And we are literally reaching thousands of people. We have over 8,000 people who we've been training this past year. We are sending out our newsletter to thousands, over 16,000 subscribers. So the impact we're already starting to see. And what was really exciting for us as we did some surveying with people who have taken our training is that our learners are telling us that what they learn is relevant. It's important to them. In some cases, it might confirm what they've already learned or known. And for others, it's giving them new information that they are able to then take into their practice and influence their work with their families and young children. What we have learned from the feedback we've been getting is that training has to do three things. It has to provide practitioners with the science. It can't just be about what we think is good for babies and their families, but rather what is the science that supports the work that we are doing and the practices and the policies that we're advocating for. The second is that as we translate the science, we actually have to go an extra step and help people to see the application of that science. How do I take what you've shared with me and actually put it into my conversation with a family tomorrow, or the work that I'm doing with a young child tomorrow in my early learning and care setting? And then finally, we need to encourage reflection, that people are thinking about not just what they've heard, but what they do, what they could be doing differently. We definitely see people who are working with this age group as leaders and really reflecting on how they can provide leadership within their own organization or circle of colleagues. All right. We've also learned that we can't just replace face-to-face training with webinars and videos that people can watch. So we've actually developed a coaching model called Infant and Early Mental Health Coaching Connect. And this happens in real time. It's live. We have a number of coaches across the country who support this initiative under the leadership of Nicole Tuzzi, and who's part of the IMP team. We have seen that between the website and the LMS, and I have to admit that part of this is the result of the pandemic, that the access, the number of people accessing it and the places that they are coming from across the country has increased substantially. And even on our learning management system, because it's so much easier to navigate, more and more people are coming to visit us, taking advantage of the free stuff for sure, which we're thrilled about, and having that seamless experience. Also informing all of the work that we do now is the competencies model. So about 3 years ago, we began work to develop a competency framework because there is no guiding scope of practice document for infant and early mental health. It is not a specific area of practice. It is something that we feel needs to be embedded into the practice of any practitioner, whether you're a physician, psychologist, social worker, early learning and care practitioner, home visitor, it doesn't matter. So the competencies framework was developed as a guide to help people understand what was seen as foundational knowledge, what was seen in terms of knowledge and skill for different functions, so promotion, prevention, early intervention, and treatment. We've also been actively working with the Ontario Centre of Excellence for Child and Youth Mental Health on infant and early mental health care pathways. This is something that doesn't exist in the country. So when a parent is concerned about a very young child, and that concern can be as early as, soon after a baby's born, or for a 1-year-old or a 2-year-old. It is really unclear to families where they go for that support. Right. And so we've been working with 3 communities, Hamilton, and these are all in Ontario, Hamilton, Simcoe, and Hastings, Prince Edward County. We've brought together a very diverse group of service leaders, so from education, health, child welfare, early learning and care, et cetera, to really help us to look at what the aspirational pathway would be for them, so that no matter where the concern was raised, that a child had equitable access to the support services and resources that they would need to support their well-being. We're also trying to keep up with technology. So one of the big things we're doing is actually trying to develop a web-based app for Nurturing the Seed, a resource that was created in collaboration and with the guidance of Indigenous leadership from across Canada and elders. So this work is well underway. We hope to be able to do a soft launch by the new year. And we've also implemented an evaluation plan for every single thing that we do. This was really important to us. We're also trying to expand that to not just what we do, but learning more about Canadian children. So we're working in collaboration with Queen's and with Dr. James Reynolds and his graduate students to develop a Canadian database for the Ages and Stages questionnaire, a commonly used developmental screening tool. And this is going to give us, for the first time, some insight into how Canada's youngest children are actually doing from birth to the age of 6. I think also I just have to mention, and Rob and Pranima can both speak to this. This data is really important because we are climbing a mountain around infant and early mental health. And I think part of the reason it's so difficult to engage policymakers and others is because we don't have Canadian data. So we're often having to reference data from the US and data from the UK or Australia. So this is actually, for the first time, going to give us an opportunity to tell a Canadian story about Canadian children. Right. So the evaluation plan is looking at all of these components, not just our user demographics, but also looking more specifically at nurturing the seed. And we have several pieces of evaluation there. The infant and early mental health care pathways, again, looking at how do we actually evaluate whether this is effective or not. So we are the person leading our evaluation strategy, Magali Buhurs, has actually developed an evaluation strategy for every single one of our initiatives that is currently underway. And part of that has actually included a self-evaluation tool for agencies and communities to use. So when people, I would have this conversation, and I won't say, it doesn't matter what province it was in, but people would say, oh yes, we're very infant and early mental health friendly. And I would say, so what are the things that you do? And so they might say something like, well, we have a walk-in program and anybody from 0 to 18 can come to that program. Well, that's great. And that's a really good start. But does that really mean that you're infant and early mental health friendly? So we've started to develop a tool that agencies are going to be able to use that will help them actually identify what their strengths are in terms of infant and early mental health practice, as well as where the gaps are and where there may be opportunities for them to actually strengthen not just their practice, but their policies, their program structure, et cetera. So what we're really trying to do with the funding that we have from KBHN is to change research, change knowledge, ultimately change practice. And I just wanted to highlight a few things that have happened as a direct result of this work. So recently we were in Temiskaming, which is in Northern Ontario. The CEO of Sick Kids, Ronnie Cohn, actually joined me on that trip. We met with elders, we met with community partners from education, health, child welfare, et cetera. And a number of issues were actually raised. And one of them was that it was very difficult to get referrals for Indigenous children in the community. There wasn't easy access to a physician. Sick Kids, through Ronnie's leadership, has already connected the community directly with a pediatrician who is now meeting with them every single month to look at what referrals need to be made and to support assessments and diagnosis. In addition, the community has had great difficulty accessing psychiatric services for children, including the infant and early mental health promotion staff. So we are now working with telepsychiatry to say we need a different model, a model that isn't based on a very Western structure, a very medical model, because it's not working for that community. So we're already changing systems. I had mentioned already the database that Queens is putting together around ASQ scores. That is going to give us insight that we've never seen before. And finally, IMP is now partnering with the World Association of Infant Mental Health to deliver a 15-part lecture series that will begin in January. And this is super exciting because we're going to be hearing from really the leaders in this field, the pioneers, people like Arietta Slade, Alicia Lieberman, Charlie Zena will be speaking about, really their life's passion around infant and early mental health. We've also been surveying our partners to better understand, what do we do well? What are our weaknesses? How do they see our context? How can we be helping organizations? How do they see our priorities? And what are some of the skills that we need to gain within our team itself? And again, this has been super helpful for us in starting to really look at that long-term strategic plan. And we need to be rethinking staffing. 5 years ago, I never would have thought that I needed an IT person. And now I'm thinking maybe I actually need 2 IT people on my staff. We need to be able to keep up with technology, things like the app. That's just the beginning. We need more project managers. We need more support for our managers. So really looking at a new structure for IMP, increased staffing, restructuring working groups so that we're all working together. And this is not an easy thing to do. As both Purnima and Rob know, IMP is an unfunded program of the hospital. So we're very heavily dependent on grants. So I'm going to stop there, and I'm going to shift over and invite our panelists to join me now. So if Rob and Purnima could join me, and I'd like to pose some questions for them in terms of the work that IMP is doing and where they see us going. So Rob and Purnima, if I can start with the first question. I recently, and I just heard something again yesterday on the radio. I hear these stories, and it could be a story about bird calls, and I get it. Bird calls are important, but it's not, it's not something that's going to affect the day-to-day life of the people who are listening to this story. And yet somehow these stories get national attention on, with our public broadcaster. And yet I can't seem to get the attention of media on infant and early mental health, which is something that affects the entire human race. And I'm just wondering, what is it that we need to do differently? What is it that all of our partners, how can we support our partners? Because I don't think this is always about IMP. It can be a very local undertaking as well. What do we have to do to get people to pay attention to this? So Purnima, if you're okay, I'll start with you and then go to Rob.
Sure. Thanks, Chaya. And thanks for your presentation. I think this is a really good point. When we started this work with you and other collaborators, probably about 7 or 8 years ago, really to sensitize our sector in Ontario to the importance of infant and early mental health, it was really, really important that we made a case, right? So we needed to let people know that by intervening early and intervening well and effectively using the latest evidence, we can actually save families a whole lot of stress, strain, and sadness. And we can also save the government a lot of money. So because as children get older, the cost of services becomes greater and greater and greater. So that was kind of the case that we had to make. And, you know, sadly, I think there are lots of wonderful stories out there that are really positive, but the ones that really get our attention are the really, really negative ones and the really sad ones. And sadly, we are, you know, in the midst of a pandemic right now. And I think that you, Rob, and I think many of the people that are tuned in today understand that the impact of the pandemic on the mental health of families, particularly families, I mean, all families everywhere, but the unique experience of families with small children is just, it's just tragic. And so I think that as we become a bit more aware of what the impact has been, and sort of try really hard to bring that knowledge to people, I think we're going to get a bit more traction over time. Sadly, that's sort of where I think we are at. You're on mute, Chaya.
Yeah, and just to add to that, you know, it's during the pandemic, one of the things that I was certainly acutely aware of was we were hearing a lot about, you know, the challenges for children going to school. So there was lots of conversation happening about school age. For the first time this morning on CBC, they actually had a story about the fact that moms had absolutely, in some communities, no support for things like breastfeeding. And it was the first time. And I've even noticed things like, you know, and I don't know how familiar the audience is with neonatal intensive care units across the country, where parents are actually being limited to 1 hour a day with their little baby who is, you know, obviously not well because they're in an NICU. But imagine being limited to 1 hour a day. I'm seeing babies who have been at home and only know a pandemic world, starting childcare, and their parents are having to drop them at the front door of a daycare center to a perfect stranger who's wearing a mask. And how traumatizing all these things are for both children and families. So, you know, Rob, like you have lived this life, like you were in the thick of policy. And why is it so hard for us to have policies that recognize and really support that early mental health component of our development?
Yeah, it's a huge question. I think the first comment to say is that we have to understand what it is. We have to understand what it is to get the attention of the media as well as policymakers. As Purnima mentioned, there's many routes to get attention in terms of what your audience values. In terms of the policy environment, it's a real challenge because some of the busiest people I've ever worked with, present company accepted, are elected officials and public servants, especially in a shared intersection like infant mental and early mental health. And so because we're also, you know, for the first time in history, really living in an attention economy where the biggest companies in the world, Facebook and Apple and Google, they're billion-dollar companies because they have learned from the evidence about how to catch and never release the attention of the public. And so there's clues in there, I think, for us in early childhood and infant mental health, because if we can harness those same tools, but for the good, in terms of the media's interest as well as elected officials' interest, because in both respects, what they're really trying to do is respond to and catch the interest of and ultimately serve the interests of the public. And so understanding how that works without going to the dark side of what you can do, and unfortunately is the norm in the attention economy, is the big challenge that infant mental health is facing. The last thing I would add, which is also a very direct gratitude to the IMP team that you've been leading, Chaya, is you really got to start from scratch. You got to work over 25 years, which is when I first met you. You have to start from scratch, create an ecosystem, start thinking about the infrastructure and the infostructure, the data that you mentioned. And that's a huge challenge when this is not embedded yet in the early pathways of most of the sectors or the professions or the services that are essential for optimal infant mental health. And so you really are undertaking one of the biggest challenges I'm aware of in this area, and yet you still work hard as a group, and this is the collective effort. And so coming back to the question, the bird story is probably on there because it's novel, because it's surprising, and that's been helpful in this field as well. Many people don't even know that infants have mental health. The concept is only maybe half a century old. And so there are angles like that which respond to our understanding about people's desire for surprise and novelty, for using the tools for good to capture and hold people's attention. And there's a whole literature on clickbait, and there's a good kind of clickbait we could probably look at. And then coming back to that all-important public, because that's who elects our policymakers. Those are the voices that need to be heard. And as many in our audience already know, the younger you are, the less likely you are to get the attention of policymakers. And if you're a baby, very challenging. And in the health space, which is of concern to most Canadians and people around the globe, it's also very challenging to get the attention of the early development, and especially the early mental health and development of young people. So you have the orphan problem here as well.
Yeah, no, and it's true. And I even think about, the climate conference going on, and even that for me is so related to infant and early mental health. And I hear people talking about the anxiety that even young children have about the environment that they're growing up in, and the climate worries that they have as they get exposed to all of these conversations. And yeah, it is definitely a struggle, to say the least. And I think that's partly, when I have that slide about looking at staffing, I feel like part of what we need to do, and the KBHN funding is really helping us with, is free myself up to wage some of those battles, right? And I hate to put it in that kind of language, but it really sometimes feels, and Pranima, you've been right by my side with some of those battles, where it's like, how can you have a conversation about mental health and not include not even birth to 6, but prenatal to 6, right? And that really takes us into the next question. In order to truly address mental health across the lifespan, infant and early mental health must become part of the broader mental health conversation. And this has been very challenging for us. In what ways can IMP get more traction on this, and with who? Like, should we focus our efforts on government or private funders, researchers, policymakers? Should we be developing policies and putting them in front of people? This is where I have to say KBHN has been truly a unique funder. PHAC is also a funder for IMP, and they get the work that we do, but that's their job, right? Like, they are Public Health Agency of Canada. They are looking across the lifespan. When James first sat down with me, and it was, I don't know, must have been about 7 or 8 years ago, we were sitting in a restaurant in Toronto, and I was just in awe of the fact that a neuroscientist actually understood that early mental health was also about brain development. And he could see the value in connecting those things. And he has really championed the work and supported us in securing funding from KBHN. So it's been great working with James, but he's going to retire in a few years. And I'm already nervous, right? Like, how do we get to other levels of government, to other researchers and policymakers? What is the best strategy for us to reach out to those people? And understanding that even within the hospital, we have a foundation, but we compete with every other cause at the hospital, and every other cause is a good cause, right? Like, you can't dispute that. So I can't go to funders unless I have permission from the foundation, in case we're competing against something else that the hospital is putting forward. So even that is fraught with challenges. So I'll go back to you, Pranima, and start with you on any advice you have.
Yeah, I think, I'm sort of mid-career now, right? And so I've kind of seen a lot of stuff happen, and my observation, particularly in children's mental health, is that nothing really happens quickly. And so there's a slow sort of sensitizing people to the importance of something, and then, reinforcing that message again and again. And I think when you say, get more traction on this with who, I think yes to government, yes to private funders, yes to researchers and policymakers. I think there needs to be a line to every single one of them, which is a lot of work, which I look back to your evaluation, and I think I'm one of the people that said you're kind of like you're a small shop and you're the little engine that could, and you keep going and going and going, which is really important. But it is about expanding, and it is about making sure that, there's one Chaya and there's one Nicole and there's one of each of your team members who are all fabulous, but you need to sort of be able to attract, the attention of all of those different players, which means pulling new people in. And I think your strategy of partnering has been a really good one, because it means you have sort of, an arm into a number of different potential areas. So I think that's really good. I just think that these things take time to sort of evolve. And if I think about the first policy paper, which you were involved in, that we did here at the center, that was 8 years ago. And then we did another one 5 years ago. And now we're doing this work starting 3 years ago. So I feel like we're sort of building in terms of our work here in Ontario. But I would say it really is multi-layered, multi-level, and multi-pronged in terms of the strategy to get people's attention. And then there's also that burning platform. So again, this pandemic has given us a lot of challenges, but there's also been a lot of resilience that we've seen children in particular show. And I think what we need to do is tell the stories of those resilient kids, but also against the backdrop of some of the kids who haven't done so well. And we need to really create an urgency around that story.
Yeah. Rob, any thoughts?
Yeah, just to add to what Purnima said, which I completely agree with, yes to all of the above. By definition, all of those stakeholders or audiences are essential, but they're also different groups with somewhat different values, a lot of it overlapping. And so speaking to what matters to each of those groups, showing this is the knowledge translation work as well as the mobilization work, translating in terms that matter, in terms of what speaks to each audience, of course, is key. It's of note that it wasn't that long ago that mental health wasn't part of local or even provincial, territorial, or national conversations, and now it is. Here we are at the penultimate session at a very important conference with this topic. It wasn't that long ago that I could not see any ministries or cabinet ministers anywhere across the country with a dedicated portfolio for mental health and addictions. So there is that slow progress that Purnima mentioned. So this is a long game, just as you've all been doing. And the relationship building is obviously core to all of that, because if you can maintain and nurture those mutually beneficial relationships, eventually, you move the ball forward.
Yeah. What both of you have said takes me back to when I first joined IEMHP, and we weren't doing a lot. We were doing 4 workshops and a conference every other year. And then as we started to broaden our networks and reach out, and we started to do more training, and I always thought at that time the point would come where we'd have to make a decision about investing in people. And I think that's the point that we're at. And what I'm hearing is we need to really look at how we invest. And I don't think this is just IEMHP, like for our audience, like think about within your agency how you invest in people on this file. For me, I'm realizing that we may have to take a risk in the upcoming year and say, you know what, we're hiring that other project manager. In fact, maybe we're hiring 2 new project managers, and we're providing a support to our evaluation person, because otherwise, I think we become a little bit of that jack of all trades, but an expert at none. Like we're not really honing the story well enough to get traction with any of those groups, government, researchers, policymakers, etc. So that really takes me to the next question, which is how important is data to help us overcome the challenges that we face? So I've often said, and certainly have gone on the record saying that I've encouraged James around this ASQ database because I do feel we don't have the Canadian story. But sometimes I almost feel like I'm going to have to almost use that data to shame policymakers into making decisions, because when they start to see and hear that not just the anecdotal stories, but the data that shows kids are at risk when they're 1, and that risk continues to increase, when they're starting school and nobody has stepped in, that they're going to see, the starkness, the harshness of what is happening for a lot of these kids. And I often tell a story about a little boy in the north who, was born to a mom who admittedly had consumed alcohol during her pregnancy. He was 4 and was in kindergarten and was being kicked out of kindergarten and told to go home, stay at home and he had to be at home for 8 days, showing no aggressive behavior. And he was in a foster placement before he could come back to school. And I think about that little boy and what would have been different if somebody had started to acknowledge right when he was born that he was already at a very high risk for poor outcomes. And if we had actually started to, watch his development and respond to his developmental needs, knowing what we know about brain development and the plasticity early in life that is there, if we had really leveraged that for that little boy, how different his world would be today. And how important is the data? Like I keep saying, we need the data. Is that the right thing? Do we really need the data to make our case with government, private funders, policymakers? I think we need researchers to step up and help us to a lot is on James's shoulders right now. I think we need other researchers to step up and help us with this. So Praneem, I'll start with you again.
Yeah, and I'm conscious of the time, so I will be fairly quick. I think, 100% data is really, really important. My organization is all about ensuring and supporting organizations to use data for decision making. So there's no question that data is critical. I think as you're talking though, Chaya, I think about, there are some who are sensitized to the existence of these kinds of issues, and some people that are aware that that is a data point to capture. There's just this huge ocean of people that still need to understand that, those issues that you're seeing at 4 really started perinatally, right? And so I think that both things have to happen. We need to increase awareness. We need to give people the tools that they need in order to actually get an accurate sense of what's going on with kids in that age range. And then we need to collect ongoing. So I think common data, a common assessment tool, common screening tool, common assessment tool, and common sort of, some kind of tool that measures the extent to which we're actually making an impact on kids and their families through some sort of common client satisfaction tool. And I know that the children's sector in Ontario is working towards that and making sure that we have across the age range from birth all the way to 25. I think that's going to be the task ahead of us.
Great, thank you. Rob?
Yeah, yes, worth the investment. We have to measure what matters, and for most people, our youngest, our babies matter, and we need to walk that talk. As they say, measure what you treasure. In terms of the how, I think those approaches have a role, but I think if we get to the heart of this, that there's a powerful story here. It's as old as humanity, but we've forgotten it. Our Indigenous peoples, for example, know this, and we're remembering it now. In terms of this starts very early. Mental health is part of us from before we're born all the way to our final breath. There are powerful things we can do that can not only save money down the line, but can transform and save lives together. So I think this is definitely worth this kind of conversation to continue.
Yeah, yes, and that really nicely brings us back to where I started at the beginning of the presentation with nurturing the seed, and I want to just pay homage to our Indigenous partners who have created this incredibly safe space for my team to learn and to make mistakes, because we do. And all of that learning has influenced what we're trying to do with our funding from KBHN. And so I agree with you. They know this. and organizations like Wisdom Keepers, Keepers of the Circle, Anishinaabe Nation, they are leading the way. They are telling us and guiding us, not just about Indigenous children and their early mental health, but Canadian children, prenatal to 6. So with that, I want to thank both of you for joining me in this conversation. I've as always, have enjoyed hearing from you. And with that, Jody, I'm going to pass it back over to you.
Okay, so just so you know, what I said there was phenomenally important. I'll tell you what, that panel was so, I was sitting on the edge of my chair because trauma, mental health. I was 10 years on a locked psychiatric inpatient unit at the Alberta Children's Hospital, where those kids and families taught me the most about the importance of early intervention. And the stigma of mental health is rampant. As we still know, it is something I think that I talk about all the time. And really, even I think that additional struggle that happens when we're talking about infants, even in that stage of, when they can't even advocate for themselves, or their behavior isn't such that it's sort of drawing attention to at this point. How do we understand and continue to advocate in that way to say early intervention not only matters, but it changes significantly the outcomes? And so I love those conversations. I think that we're just getting in. It is just such an honor to listen to all of you today. And I hope that, if you get an opportunity to follow their work, to revisit this conversation, please do, because I think it is one of the most important things we need to talk about in the days and weeks and months, particularly as we navigate this pandemic, the effects of the pandemic on our babies moving forward. So with all of that amazing stuff, we're going to step right into now a intermission. I really take this minute to just write down your thoughts, connect to other people on this platform. This is just such a unique opportunity, I think, today to sit with some of the most important and innovative people in this space. So use this time, get a coffee, walk around, just look after you, drop those shoulders a little bit, and then we will step back in as we wrap up today in 15 minutes from now. Enjoy your break.